Hello, pharmacist. Good evening. Can you hear me?
Yes, I can hear you. Good evening. How are you, Destiny?
I'm doing very great. Thank you so much.
Okay, that's good.
It's good to see you.
It's good to see you too after a long time. I think my video isn't good. I don't know if you're able to see me.
Yeah, I'm getting okay. Can you hear me clearly now? Can you hear me
Yes,
clearly
I can
now,
hear you.
pharmacist?
Yes. Yeah, I can hear you.
Fantastic, fantastic. So um just going to put on up my slide now. For those in the YouTube channel so they can see, and then I'll come back here to the studio.
Oh, okay.
Okay, seeing, okay, yeah, sure. Okay, so welcome once again, fam, and it's great to have you join us. I'm just going to try to set up some things and send the link to the YouTube to our waiting room so that people can join from the YouTube chat.
Oh, okay.
Great. Okay. Just a second, please. I think we're already live, but um, I'm not sure people are able to view us right now. So I'm going to try to send the link to them. Okay. Your network doesn't seem to be very strong over there because I can't see your video.
Yeah, are you able to hear me?
Yeah, I can hear you loud and clear, but I cannot see your video. The network doesn't seem to be very strong there.
Yeah, okay. You can see me now.
Yeah. Great.
I did not notice that actually my camera was still off.
Okay. I see. Yeah, it's saying the network bandwidth is low. You can show that here.
Oh, okay. We
It's
usually
it's
have little changes.
it's
That's
good
not
to
quite,
see you.
people here using internet.
Oh. It's good to see you after a very long time. It's been like decades now or thereabouts.
Yeah, I think it's been almost close to a year. Yeah, the last time I think we spoke should be April, either April or March last year. Yeah.
Yeah,
How have you been?
I've been
What's
good.
been school? Are you done now?
I've been great. Pharmacy school has been fine, and yeah, I should be rounding off this year. So yeah, I've been really good.
No, that's good. Congratulations. Yeah.
Thank you so much. Thank you so much. So I'm sending the link to the group now. There was a mix up. The link the meeting I scheduled before on YouTube um wasn't the same link I shared with you. So I just had to use this one. So sorry about that.
Oh, okay. Okay. No, it's fine. It's fine. Yeah.
Okay, so I've already shared the links on the group chat. So I think we can just start now. Um, Hello, good day, everyone. Good morning, good afternoon, good evening, depending on wherever you're joining us from across the globe. So those of us joining us from the live streaming on YouTube, welcome. And a very special welcome to our guest for today, the person of pharmacist Gibson Free from Zimbabwe. Thank you so much, pharmacist Gibson Free, for being part of this amazing session today. We're glad to have you.
Thank you so much. This it's not actually Zimbabwe. It's Zambia. But of course, Zimbabwe and Zambia, the differences are very minimal. We're almost just one
Oh,
and the same people.
oh wow. I've always been
Yeah.
thinking Zimbabwe. Oh my goodness. Oh, Zambia. That's nice. That's nice. So for those of
Yeah.
us watching from home, what if I told you that right now, across the world, healthcare is quietly shifting, and many people won't even realize it until they've been left behind. Genomics and pharmacogenomics are no longer just research topics for academic conversations. They are becoming part of real clinical decisions, real policies, and real jobs globally. You're joining the very first edition of the Pharmagenosphere Community Engagement and Ask Me Anything series. And we're glad you're here, very honestly, because today's conversation is not going to be theoretical at all. It's going to be very practical and around all of the challenges that we're facing as countries in LMICs and how to solve these problems. Around the world, organizations like the World Health Organization are rethinking how genomics fits into healthcare, not just in high income countries, but across low and middle income settings as well. And the real question is no longer whether genomic will shift the future or shape the future of medical practice. The real question is who will be ready when it does. Today's session is about understanding pharmacogenomics and genomics and how they've been going globally, and how you, very importantly, can position yourself within that future. Over the next few hours, we're going to do three very important things. First, we will unpack what the World Health Organization's genomic reports actually means for you, not in policy language, but in practical terms, focusing on amazing opportunities that the report presents, especially for low and middle income countries of the world. Second, we'll walk through a real tool, CleanPGX, the one we used to know as pharmGKB. This is kind of like a mini workshop. So you can see how pharmacogenomics is already being applied in clinical setting. We'll open the floor for a live Ask Me Anything session where we'll get to take your questions about anything pharmacogenomics, as well as Pharmagenosphere, the organization organizing this event. And finally, we'll take an insight into the Pharmagenosphere Global Ambassadorship Program. We've received a lot of questions over the past few weeks, and during this session, we're going to take questions from the live chat so we are able to answer all of those questions. If you're watching on YouTube, I encourage you to stay engaged. Drop your questions in the chat box as we go, whether you're a student, a clinician, a researcher, or someone that's simply curious about the field and where it is headed. Now let's begin by looking at the big picture, the global opportunities emerging in pharmacogenomics and genomics, and why the World Health Organization believes this movement matters. So for this part of the series, this edition of the program, we're going to be looking at, like I mentioned earlier, 4 areas, but 2 very important areas. And the first one is the global opportunities that arises, that we can see inspired by the World Health Organization Genomic Report 2025. The Genomic Report was presented in December 2025. And in this first part of the session, we're going to talk about opportunities, global opportunities in pharmacogenomics and genomics that each and every one of us, whether we are students, clinicians, researchers, can delve into, while explaining the World Health Organization Global Genomic Report in details, in such a way that you can relate to very simply. And then the second part is going to focus on a mini workshop, like I mentioned earlier, how to use CleanPGX, how to navigate CleanPGX, the one we know as pharmGKB. So this is going to be specially led by our guest for today, pharmacist Gibson Free. And then again, we'll talk about the Pharmagenosphere Ambassadorship Program. We'll give an overview and answer questions that you have. Now, I'm going to start by giving us the key messages from the Global Genomic Reports as presented by the World Health Organization. I'm going to display that now on the slides so we can see that very quickly. Okay, I'm not certain if this is very clear. Pharmacist Gibson, is it very clear on your end? Hello, Pharmacist Gibson, is it very clear on your end? Can you see the slide, the key messages?
Yes, I can see.
Amazing. So these are the key messages from the World Health Organization Global Genomic Report. And from looking at it here, the first thing we can see is that human genomic data used in clinical studies is accelerating. So the study that the World Health Organization did in that report basically captured clinical studies that were conducted and registered between the year 1990 and 2024. And over 6,500 studies involving human genome analysis have been registered globally, with rapid growth from 2010 owing to improved sequencing technologies, low cost, and expanded clinical applications. And then the second thing, which the report captures, is that genomic research is geographically concentrated. Now, 10 countries accounts for over 70% of genomic studies, with 68% in high income settings and less than 0.5% in low income ones. This concentration reflects global disparities in research capacity and access, even within wealthier nations, where access to genomic research and medicine may vary by ethnicity, socioeconomic status, and geographical location. The third thing that the report captures as a key message is that genomic research is centered on non-communicable diseases, although infectious diseases represent an untapped potential. Over 75% of genomic studies concern non-communicable conditions such as cancer, rare diseases, and metabolic disorders, right? And then the fourth thing that the report captures is that participation in genomic studies is uneven across the life course. Okay, so participation is uneven. We don't have representation of children or the very elderly people, but we have representation from people of just average age. Okay, we have adults, but we don't have children being represented as they should be represented, and we also do not have adults being represented as they should be represented. And then the fifth thing that the report captures is that efforts to improve equity and impact will require more inclusive, globally aligned research strategies. Okay, so this is part of the reasons why we are here today. The very last point that is captured in these key messages is part of the reasons why we are here, because we're part of putting efforts together to improving equity, right? And so during this session, we're going to try as much as possible to do the best that we can to show you the opportunities that exist in this field, in the field of genomics, that you can delve into, inspired by this global genomic report by the World Health Organization. So I'm going to move now to pharmacist Gibson. I'm going to ask some questions about these reports and what you think about these reports, what it means for our setting, what it means for countries in low and middle income settings, as well as how we could navigate this. At least, let's just start with what this report means for countries in LMICs before we delve into other areas, pharmacists, or perhaps starting with what your thoughts are about this report. When you first saw the report, when you read through the report, what crossed your mind?
Hello, Destiny, are you able to hear me?
Yeah, I can hear you. Can you hear me?
Okay, yes, I can hear you. I think the network became a little bit unstable. Um, I got your first question. What first came to my mind when I read through this report? Two things, Destiny, came to my mind. The first thing, of course, was that there are a lot of opportunities for Africa, because I see a lot of gaps in this report, and those gaps need to be filled in. The other thing that the report highlights is exactly how vulnerable we are here in Africa. It's not just Africa, but also other countries that are part of the LMICs. You look at how skilled and vast these opportunities currently are sitting. Quite very sad. Out of all the countries that are participating in the current genomic studies that are going on, you realize that only about 10 accounting for 70 to 80%, and the rest of the countries are getting only a small percentage And if you come to Africa specifically, the report highlights that Africa is not taking any leading role in any of these, research that's going on. We are just, playing a collaborative role, and mostly, Africa is only, playing a part of, study science. So you get to realize that much of the genomics data that is, being generated from all these clinical trials that are going on, ultimately may not even be really much of benefit to us Africans, because at the end of the day, the genomic information that is being generated mostly is to benefit the populations that are where the funding is coming from. So for me, the first thing I saw was that we are vulnerable at the position where we stand, because when you speak to future clinical management of diseases, etc, the future goes into precision medicine. And as we speak to precision medicine, we're now talking about genomics. Yeah, so I picked really that there's a lot of vulnerability when you look at countries that fall under the LMIC category. But also away from that, like I said, there are also quite a lot of opportunities because it speaks to advocacy gaps, infrastructural gaps, research gaps, also skills gaps. Meaning that all those are gaps that if we are creative and innovative enough, like Destiny you are doing already, we can begin to fill up those gaps.
Amazing, amazing, amazing.
I didn't get the other questions.
Yeah, amazing. Thank you so much, pharmacist Gibson Free. We're going to come back to you very, very quickly. You've said a lot of things there, a lot of things. It's so much of a challenge. Yes, we acknowledge that. And you've also hit the nail by saying that it's so much opportunity for us. It's so much opportunity for anyone looking to get into the field. It's so much opportunity because there is diverse areas that you can literally go into and be able to contribute to the field. And I really love that. And of course, it's certainly at the heart of the reason why we are having this conversation today. So I'm going to come straight right up to you in a few minutes. But before I come back to you, I'm just going to talk about very briefly some things around the report, some things around why the report, why the World Health Organization even thought to make the report in the first place, and what problem they were responding to in drafting this report. So I'll just do that very quickly. Now, the World Health Organization produced the Global Genomic Reports to respond to the rapid integration of genomics into healthcare and public health worldwide. So, like the report mentioned, from 2010, yes, there's been a lot of those studies that were registered. And the report also clearly outlined that the factors responsible for this are not far-fetched. You have the increase in technologies, the fact that sequencing got even cheaper, right? So a lot of these things were part of the reasons why the World Health Organization thought to create this report, to do this report, to carry out this study and bring out a report. While genomic technologies are advancing quickly, their benefits are not being shared equally across countries. That's something that is really bothering. And the World Health Organization's role is to ensure that genomics is implemented safely, ethically, and equitably as part of the global health system, not just as a research tool, but as public health resource. So it was important that the World Health Organization took a stand and present this report to the world. And what problem is the report responding to? The report basically responds to three main problems, in my opinion. Haven't gone through the report. And the first one is the inequity challenge. The genomic medicine states as we have it, is currently concentrated in high-income countries, leaving many low and middle-income countries underrepresented in research and underserved in clinical implementation, which is something that pharmacist Gibson has just emphasized. And the second thing I think is that limited access. Okay, many health system lacks the infrastructures, the policies, and the pathways to integrate the research that is being generated from genomics into their workspace. And then thirdly is the workforce gap. Now, there is global shortage of trained professionals. And this is even very dominant and very true when we come to LMICs. So these were, I think, the three problems that the World Health Organization's report was responding to. Okay. So now we have like a background of what the report is about. We have a background of what the report represents. We have a background of what the key messages in that report are. Now, the next phase we're going to delve into now is going to be the workforce and capacity gap. So we're going to be selecting some different themes from the report, and we're going to be discussing them. Workforce and capacity gap. So I'm going to be coming back to you, pharmacist Gibson. The report has reported that there's been a lot of gap in workforce, and it's even very true when you come to LMICs. How do you think, in your opinion, can students, clinicians, researchers step into this gap and be able to bridge this gap, putting into context that we have limited resources in this part of the world? Pharmacist Gibson.
Thank you very much, Des. So you see, you've already mentioned, our biggest challenge at the moment in low and middle income countries is the issue to do with availability in the first place, availability of, the resources. So you get to realize that our main focus is on availability because that's our biggest challenge. So we do not even get to ask questions such as, even when this thing is available, is it safe? Is it effective enough? You get that? So I'm trying to speak to health commodities ultimately. So you get to realize that mostly we are more focused on it should just come. When it has come, we use it. It goes like that. Did it work? We are rarely concerned about whether it worked. We are rarely concerned about whether it was safe or not. So that also creates a challenge where things like workforce development are concerned. So at the moment, you find that governments are developing policies. Mostly the interest you find that making available products, but not really developing workforce and also improving how we are delivering those services through workforce. I'll give you an example. There are a few countries like right now in Africa that are supporting programs to do with genomics. Quite a lot is being done in South Africa. I'm aware a few things being done in Zimbabwe. Zambia has introduced a program at postgraduate level to do with pharmacogenomics. You get to realize that these conversations are conversations that are not going on in many other countries out there. The reason is because our major focus is making the products available, not really focus on that service. So you find that there isn't even any advocacy going on around the issue of improving how we deliver in these services, which would also border around issues to do with bringing genomics into service delivery. You get that. So first things first. For me, what we need is advocacy. So we've got very few voices right now, in low and middle income countries that are pushing these conversations. We are talking about lethal communicable diseases at the moment that have started growing in terms of numbers here in Africa. But the solution still lies in precision medicine. But you get to realize that there is little advocacy going on at the moment. Apart from advocacy, there is also little interest in skills development. Like you said, there are no resources Of course, how much do you need for you to just buy one next generation sequencing machine? It's very expensive. You get that. So you get to realize that even the research itself, most researchers are interested in things that they can easily get, not really things that can bring solutions to our problems. That also affects workforce development, research capacity development, skills development, all those things. Yeah, etc. So the first thing for me is advocacy. That's one opportunity that we need to go into as the young people, those who are into the clinical space, the students. We begin with advocates at the moment. We advocate for, better services. We begin to advocate for, research funding towards the government to begin to allocate funds towards that. We advocate for, skills development, in these universities, because there are a lot of opportunities coming ahead, in the area of genomics at where with regards to where the future lies. You get that, because for me, I do believe to say there's going to come a point of time when questions will be asked. We have this product, but does it really help, right? Because when you look at the future of, for example, just cancer itself, WHO has published a study some time back, mentioning that cancer prevalence is going to increase by between the year 2035 to 2050. We'll be speaking to at least one in 5 people likely to develop a cancer in their lifetime. You get that. So all those insights that we have for the future should drive us into advocating for human genomics technologies in order to improve our healthcare systems.
Amazing, 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 amazing. That's amazing. You've made a lot of points there, pharmacist Gibson. A lot of points that speaks very, very, very straightly to the heart of the problems that we're facing. And my next question is going to take a kind of like a shift from looking at the research and the workforce as well as the capacity to clinical integration, right? So I was during the last webinar session we had in our ongoing webinar series, we were privileged to have a pharmacogenomics researcher from Syria, Dr. William Aldeban. Dr. William Aldeban gave a very, should I say, a very insightful example of what they are doing in Syria currently. So what they do is, rather than screening for getting the whole genome of a patient, that is doing whole genome sequencing, they just go for the panels, right? They go for a panel that contains certain genes. We're talking about pharmacogenomics now, clinical implementation of pharmacogenomics now. Now, they go for a panel that contains certain genes that they've studied, and they've seen that the genes are of great importance to their population, right? So those specific variants that are of importance to their population, they take out those and they have them on the panel, right? So that when they are doing that testing, the results they get from the testing would be very, very useful for that patient immediately. You see, this is part of the, this is the line of the question I'm going to ask you. How do you think that we as countries in LMICs and in low resource settings generally can start to look at things like this, can start to look at, okay, let's start small. Let's do just this drug gene pair. Let's do just this one, or let's just focus on cancer therapy for the now, or let's just focus on cardiovascular diseases for the now, right? So how do you think we can start to look at these directions and start to create policies that would be able to work in these directions, Pharmacist Gibson?
Thank you so much, Jesse. I'll give you a practical example of what I, as an individual, thought could work for my setting, the setting where I'm currently based, which is Zambia. So I would tell you first thing first. You see, the academic industry has got a lot of influence to shape, policy direction, because most of the, data, the results from the data is coming from the academia and the researchers, right? So we've had a challenge with implementation. We do a lot of research in Africa, quite a lot around a lot of issues, but not really in the area of genomics. But we get to realize that our implementation is very poor. So most of the research just ends at the level of academics. That's all, just having the information. But how do we go about influencing policy for implementation? That is the component that is lacking. First thing first, for me, what I've come to learn is that universities should be at the forefront, of guiding, career paths for the young generation, the undergraduate students. I like quite a lot that you guys in West Africa are doing, specifically Nigeria. I've seen you having a lot of conversations around, genomics, but like I said, not every African country is doing that. For me, what that simply means is that there's somewhere where you're getting some mentorship, there's somewhere where you're getting some guidance, and the people that are guiding you have seen to say, for us, to realize some of these things, we need to begin investing into the young people. So, like currently for me, I'm working on research, and I want to use this research as a stepping block for other greater things. I'm doing an integrative analysis, on some gene mutations and transcriptome signatures that are essential, in conferring survival as well as drug sensitivity in cervical cancer. But you see, the interesting thing so far is that you get to realize that most of the data sets that you are going to, pick from the Cancer Genome Atlas, there is little that relates to Africa. So you get to realize that you have over 50,000, genes that you're looking at, and all of those genes were picked from individuals outside Africa, right? So our thinking is, when we are done with what we are doing at the moment, we look at exactly, how genes, certain genes, certain mutations influence, drug sensitivity, drugs that are administered in cervical cancer, and also how they affect survival. We can use that, to begin pushing for funding to begin implementing our own, genomics research here back home. That's the path that we want to take. If we can give a picture of what is happening out there and how they're using that data, to influence research, we believe to say, even here we'll be able to begin something. The next stage is, once we publish, we begin to engage policy and decision makers. So, look, this is what we are seeing. This is what's happening. We find that most of these drugs are not working in these populations. Populations right now, we're not sure, because there is little research going on. For example, go to the TCGA, you get to find that there is little information about, little data about, African populations. So we need to begin also putting data into, such repositories. Where do we begin from? Begin to collect data from our own people, right? Back home from here. So for me, practically, that's one thing we are looking at the moment. Once we publish that research, we begin to engage the ministries of health, have conversations around that, give them a picture of what is happening out there, and show them why it's important that even us here back home, we need to begin looking into, generating that data for the benefit of our own population. So first things first, like I said, this should be driven by academic institutions, because most of the mentorship comes from there. So if academic institutions are, are not, pushing conversations around, genomics, specializations in genomics, pharmacogenomics, etc., you get to realize that there isn't going to be a generation that's going to pick a serious advocacy, pick, lines of implementation, in the fields of genomics. Just one thing to mention. You see, I'm part of the first cohort from the University of Zambia that is pursuing pharmacogenomics. Like, I'm almost done at the moment. I'll tell you that in as much as it has been quite interesting, there's been quite something sad also happening. You realize that from the first cohort, there wasn't really a second cohort. And the next year, uh, there isn't much of advocacy coming from the academic institutions. There isn't much of mentorship. So you get to realize that there's a lot. 1 year goes, no one enrolls. Then the first cohort goes, the second cohort there's blank. You now have a third cohort, hoping that people can enroll. So it still goes back to academic institutions. At undergraduate level, are we mentoring young people? Are we giving them conversations around genomics and the future of healthcare services?
Amazing, amazing, amazing. Thank you so much. I can't agree with you more on that because um it's literally the same challenge that we're facing over here in West Africa. And just to talk to our viewers on YouTube, I see that a whole lot of us are viewing on YouTube. So I want you to drop in the comment section um, what pharmacogenomics implementation is like in your country, in your region. What pharmacogenomics implementation is like in your region. I mean, if you're a student, a pharmacy student, a medical student, a nursing student, a biochemistry student, how well is pharmacogenomics or genomics, the concept of genomics, integrated into your curriculum? How much of genomics are you being taught? We just want to see your reactions and your comments in the comment section. This means a lot to us. Please try and drop your comments in the comment section about how much of pharmacogenomics or how much of genomic concept is being taught in your country. Now, to just add to what you've said, Pharmacist Gibson, I think it is a very big challenge that we're facing. During the last session we had, that was the session we had with Dr. Zaina the first day. I shared an experience about my encounter with one of my superintendent pharmacists who has been in the practice for over 15 years. And I reached to him and I told him about the fact that I wanted to take an excuse to go out for an event that was happening in my school that day. We were having a research conference. And I went to meet him and told him, oh, I want to go for this conference. And he asked me about, oh, you seem to be like someone that has figured everything out. What do you want to do in life? He just asked the question. And then I told him, oh, of course, I don't have anything figured out. I'm just interested in pharmacogenomics and precision medicine. And that's what I think I want to do. And he was like, what is that? What does that mean? I was surprised. I was surprised because this is someone that, of course, is very, very grounded when it comes to pharmacy, pharmaceutical care, and like other areas of pharmacy. But I was surprised that he didn't know so much about pharmacogenomics. And it's something that even buttresses the point that you just said now. The interest from our academic institutions are not as much or as strong as they should be. In fact, in my own university here, for example, University of Benin, Nigeria, the amount of pharmacogenomics we do is just in my third year, we are taught about pharmacogenetics, what it means. We are taught about some examples. We use warfarin and some other medications, right? So we just look at the basic aspects of it. We don't really go deep into it to see how, okay, how do you interpret pharmacogenomics test? How do you integrate it into the electronic health record? How do you ensure that it's part of managing the patient's disease condition? None of those is treated. And from the look of things, it doesn't seem like there's any effort from the people making the curricula as regards integrating it into the curriculum. So it is such a big problem that I think that we all have to solve together. But of course, just like we're doing here now, advocacy efforts like this would definitely help us. And I believe that the persons who are on the YouTube channel watching live would be able to take this message to their respective institutions to be at the forefront of taking the message of genomics, the message of pharmacogenomics, the message of precision medicine to the ends of the earth to ensure that the patient benefits entirely and very optimally from this new medicine, which of course is not new, by the way. So I don't know if you have something else to say about that, Pharmacist Gibson. If you don't, I would like to go to the next aspect of the
Yes,
discussion.
yes, Destiny. Just a few words, just quite similar from what you've just explained. The first time I just got enrolled into this program, I even got a scholarship. I had a conversation with one of the professors. He asked me a question. Who is going to employ you? Where are you going to work? What are you going to do with that thing? Is it important? Right? The last time I did a presentation at the annual scientific conference for pharmacists here in Zambia, I was again asked a question by someone. So, who is going to employ you? So, you see, this is the challenge, like I said. At the level of mentorship, like you have explained in undergraduate, we talk about pharmacogenomics. So, after talking about pharmacogenomics, it's a by the way conversation. Genomics is a by the way conversation, right? At undergraduate level. When one is done and they're thinking of specializing, they'll be thinking of what should I do so that I should get a job. You see? We're not thinking of what can I do, so that I can be part of the solutions to the problems that the continent of Africa is currently facing with. And when I become part of the solutions, then I would have created employment for others, right? Because for me, I see, great employment opportunities in the field of genomics because there is quite a lot of gaps. But you see, like I earlier said, whether we like it or not, there's going to be a time when everyone of us, our minds, will focus on genomics. So to the young people who are listening to us, I would encourage you to say the earlier, the better, because uh, research is shifting at the moment, treatment modalities are shifting at the moment. We will not be able to manage these metabolic disorders with the way we do things. One size fits all. It's not going to be like that in the near future. Rare diseases, it's not going to be like that because even right now, when you talk about communicable diseases, we're now talking about pathogen genomics. The conversation is changing. So the area will begin to fit into the coming future. The better for actually us, the young people.
Amazing, amazing, amazing. Yeah, yeah. You know, um, the thing you said there about the fact that medicine is changing very fast is something that a lot of persons do not get. And they are very quick to tell you, like you mentioned, and like the experience you had, where are you going to work? Who's going to employ you? And um, I don't get, what are you going to do? Because a lot of persons seem to just think of the very traditional jobs that we have. If you're a pharmacy student, for example, you're thinking of probably opening a community pharmacy and dispensing medications. You're thinking of going to the hospital somewhere to be part of the healthcare team. And that's absolutely very fine. That's absolutely very fine. But the kind of situations, the kind of conditions that we have in Africa and in other LMICs is the one that makes us to realize, and the one that we have to realize that the problems are a lot. And for us to be able to solve these problems, we have to look beyond going to sit behind the counter and dishing out medications. We have to think beyond that. We have to look at how do we solve problems that will employ more people, just like you mentioned earlier. How do we create more jobs for more people? Because we know we've been saying it for years, and as research has greatly showed that Africa is the center of genetic diversity. Africa is the center of diversity in genetics. So the amount of genetic information that we have in Africa is one that can revolutionize how healthcare is being practiced currently. And how do we get this information out? How do we get them out? It is by going into the field. It is by holding on and saying, oh, I want to be part of the solution to this problem. And the thing I used to tell people a lot of times is when there is a problem, there is opportunity. for you to be part of something. And solving a problem means a lot of opportunities for you and a lot of gains for you. So when I'm talking opportunities now, I'm talking of gains, whether you're looking at the financial aspect, you're looking at the name that is going to give to you, you're looking at just every other aspect of life, right? So the fact that there are these problems and this problem exists means that we should look at them and see opportunities. And that's part of the reasons why we've organized this session today, to show you those opportunities that you can see and you can actually delve into as far as this field is concerned. And this World Health Organization genomic report basically opened up that conversation and showed us all of these things that we can actually delve into. So that's going to be the next thing we're going to be going into now. But just before we go into that, I'm seeing in the comment chats, a lot of persons have dropped some messages about the current state of pharmacogenomics integration in their curriculums. And I'm seeing someone here saying, I think this person is from Nigeria, is saying that pharmacogenomics is being taught in their school, but it's just the surface, right? Just the basics. Okay. Seeing another person's comment here. Okay, pharmacogenomics is not taught in their school. Okay, a pharmacy school. Okay, amazing, amazing. The comments here are amazing, and it goes a long way to buttress the message you just highlighted earlier, Pharmacist Gibson, that our institutions are not doing enough yet. They are not doing enough yet to ensure integration of pharmacogenomics into the curriculum. I came across a study that was conducted in the United States, and the study basically looked at different pharmacy schools in the United States that are approved by the body that manages the pharmacy schools in the United States. So it looked at the different schools and looked at how much of pharmacogenomics or genomic concept is integrated into their curriculum. So it looked at the different schools, and what it found was really interesting. That yes, America is a very advanced country when it comes to genomics, precision medicine, and all of that. So it's expected that pharmacogenomics is being implemented into their curriculum. But you still see a lot of schools, even in that abundance of resources, abundance of policies, abundance of the equipment, right, to do these things. You still see a lot of schools who do not have enough integration of pharmacogenomics. And in fact, the study even went as far as asking about how much of pharmacogenomics or genomics concept do those schools think they would be implementing into their curriculum in the next 5 years, in the next 10 years. And again, there are still schools who will still tell you, okay, yes, we do not have the capacity yet, but okay, we are optimistic about implementing pharmacogenomics, right? Or implementing genomics concept more into our curriculum. But I've never seen any such study that has been done in Nigeria, that has been done in any of these West African countries. I think I've not looked beyond West African countries. I've not looked at South Africa. I know that South Africa has done a lot of work in the field. Perhaps you have some thoughts about that as well, about if there are countries in Africa who has been able to do these studies to know how much of pharmacogenomics is integrated into the curriculum of our various pharmacy, medical, nursing schools. Because like you mentioned earlier, it is very critical that we have pharmacogenomics implementation to the curriculum because it's at the heart of precision medicine. So I probably should take your reaction to that before we move straight to delving into the opportunities for our listeners and our watchers on YouTube. Pharmacist Gibson.
Thank you so much, Pharmacist Destiny. The truth is, I've also not come across a study that has, ask that question with regards to how much PGX is integrated into our curriculums in schools around Africa. Like I said, at the moment there is little interest, um, uh, and that interest is coming from a few people. Uh, Not everyone is really much interested. Probably because the younger ones are not really at the center of decision making. Most people, like I said, are looking at what can they benefit from the next 1 to 2 years. They're not looking at what can I benefit from, what can we benefit from, what can the country benefit from in the next 10 to 15 years. So to be honest, I don't think there is such a study currently. I don't think there is such a study, but there is a great need for us to realize, more especially for those in the pharmaceutical profession, um, our relevance in clinical practice lies much in pharmacogenomics. I would say that truth plainly. Yeah, I would say that truth plainly. And so the area we begin to, integrate, the better. The area we begin to advocate, the area we begin to see how best we can make ourselves relevant in that field, actually, the better. Because, like I said, there are going to be certain areas in which one size fits all will be phasing out bit by bit. It's a global shift. Um, there's nothing we can do. Yeah, and like I always usually say, most of the meetings, most of the conferences, I share conversations around genomics that Africa should not be, the last one to shift. Think of it as this. Um, right now, China is implementing a lot of genomics research. America is doing the same. And you see, like I said, much of the data that they are generating is from their population, of course, population specific. They're looking at how best can we, begin to develop drugs that can work well in our populations. How best can we begin to design therapies that can work well in our populations? So, if Africa is going to remain, thinking that we'll continue borrowing from America these drugs, we'll continue borrowing these drugs from China, we need to realize that there will come a time when we try to borrow from China, but it's not going to be useful for us. So the area we begin to invest in genomics right now, begin to understand our population diversity, the genetics around our population, and everything, the better. Because these conversations also speak to how we're going to begin, manufacturing, drugs, how we are going to be tailoring drugs to our population. Because the time of one size fits all is coming to an end. And if it's coming to an end, it simply means that if America is going to develop a drug that should work well in Africa, then it will be very expensive to acquire, right? It's going to be very expensive to acquire because right now they're working on how best can we develop drugs that are working well for populations based on their population genetics. So if they should start thinking of us, it simply means that's going to be more expensive. So yeah, the area we begin right now to have conversations around genomics, more especially pharmacogenomics, the better for us in non-Muslim countries.
Amazing, 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 amazing. Fantastic. Thank you so much. Thank you so much. You just hit the nail on the head, Pharmacist Gibson. Thank you so much. I've been seeing like very, very interesting comments in the chat. We're going to go straight to the chat very soon, but not now. We're going to move now to those career paths that we can think of emerging from this report, emerging from the disparities that the report presents, that we can think of those emerging career paths that the person who's a pharmacy student out there, the person who's a medical student out there, the person who's a nursing student out there, the person who is in the healthcare space generally out there can think of delving into. The early career professionals, even those in their in their mid career stages can think of delving into. What are those career paths that you can think of, Pharmacist Gibson, from your experience, from looking at the reports and looking at the wealth of research that is needed to be done in the field in Africa and across LMICs?
Thank you so much, Destiny. I would mention a few. of course, we've spoken about pharmacogenomics itself, pharmacogenetics. There are a lot of opportunities actually in that field. Apart from that, there's bioinformatics at the moment. I just came to hear of bioinformatics. That should be 2022, and I was like, what really is this whole thing? And I was at a conference seated next to a professor. After he did the presentation, he came sat next to me. So I asked him, say, what really is bioinformatics? How are you talking about? He tells me, say, are you a pharmacist? I said, no, I'm an intern. How come you never heard of bioinformatics before? So that field also is quite very interesting. There's quite a lot we can do in that area. There's a lot of computational biology. Right now, we're talking about big data. The future is into tech and everything. So young people can take up part in, bioinformatics, pharmacogenomics, public health genomics. Also, we need people, who can speak policy, who can help shape, policy, who can help shape implementation. So public health genomics also, those are quite very interesting fields. Fields, in epidemiology, you can take up research in, genetic diversity. You get that. We need all that, integration around, our genomics. Apart from, human genomics, there's also of course pathogenomics. Of course, most of the diseases that affect the sub-Saharan Africa at the moment are communicable diseases. So there are also quite a lot of opportunities in the field of pathogenomics. You find that everything gets to integrate around genomics, computational biology, uh, the bioinformatics, etc. So for me, that's what I would really encourage young people to take up. I know there are quite a lot of young people who may be interested in things like, okay, let me not mention it, course, but there are programs that are phased now. You see, the thing is that every generation has got its own, things, that speaks to their future. So there were things that were happening at a certain point of time, and they were on the top of the ladder, right? There was a point of time when we were just talking about pharmaceutical supply chain, health supply chain. But you see, we've reached that level in Africa where we're able to handle quite a lot in that field. So the conversation is changing, right? So for us, the young people who are part of the great future, that is the future of tech, right? We need to begin specializing into fields that are going to speak that future. And part of the fields are just like the same career path that I just mentioned. You can go into just genomics. You can go into human genomics. You can go into pathogen genomics. You can go into bioinformatics. You can just take up a few slides maybe in public health genomics, epidemiology, etc. Yeah, thank you.
Fantastic, fantastic, fantastic. Thank you so much, Dr. Gibson. Thank you so much. So right now, I'm going to just look at the YouTube comment session and take one or two questions. I see the first question here from Yes Warrior. He asked a question that you just answered now. So I'm just going to mention it now, so he knows the question has been answered. Is that how the pharmacists worldwide contribute to the implementation of pharmacogenomics and what emerging opportunities exist in the field for pharmacists? So I hope VS Warrior, you can hear me and your question has been answered. Okay, so I'm going to move now to the next question. Ayman Begon says, what should be the alternative, if not possible, at someone's country? So what should be the alternative? Oh, I really haven't thought of that. Should there be an alternative, Pharmacist Gibson?
You see, you collaborate. You remember at this the first time we met, we had our first conversation. I was telling you to say, you're a student, but you know quite a lot of things. And I don't really feel I should be mentoring you, but I really feel we should be collaborating, right? So you begin to learn from others. How are they doing it in their countries? But you see, we should be part, of a generation of, young people that believe that they should write some impact. You see, in the environments where they exist. So, like, I'll be very honest with you. Personally, I've taken up a challenge to say I should see something materialize in the field of genomics, specifically pharmacogenomics in my country. Yeah, like I said, it's quite Right now, I'm working on a research paper, the one that I just mentioned. Our purpose is not just to pack it, graduate, and ends, and graduate, pack it, and it ends. No, it's to use the findings, to begin engaging, policy and decision makers. So I don't feel there is a place where it is impossible, to begin this conversation and do something on the ground. Yeah, but the first thing first is if you feel where you are currently, people may not be very interested, people are not even saying anything around this, begin to collaborate. Yeah, like already what Destiny and colleagues are doing right now, begin to collaborate. There's some of us here in Zambia, we begin to share notes with each other and see how best we can, push this agenda.
Amazing, 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 amazing. Thank you so much, Pharmacist Gibson. Thank you so much. I think your question has been answered. The person who dropped that question. Just to say a few things for those of us watching live on YouTube, please do well to subscribe to this channel. Do well to like the video. If you've not, please do well to do that. It really supports us. It helps us to do more of such content and be able to bring even more guests to talk about these issues. So, Pharmacist Gibson, we're going to go into the next phase now, the next phase. And that next phase is about the barriers to implementation of pharmacogenomics, precision medicine as a whole. And in pharmacogenomics presentations, we usually hear about this a lot. Barriers to implementation, there is knowledge barrier, people do not know more about pharmacogenomics. There is the infrastructure barriers, which is something that a lot of the persons who tell you, no, this is not something we can practice here, seem to talk about very, very strongly a lot. There is so much barriers. There's so much that we have to get over. Could you say a few things about this before we move to the live demonstration using the Clean PGX2, please? I think our time is fast spent already. About these barriers, what do we do about these barriers? Should we just fold our arms? Should we just sit down and do nothing? Or what practical step should we take, especially in the area of seeing them as opportunities that we can delve into as pharmacy students, as students in the medical professionals as a whole?
Thank you so much. Disney, I mentioned quite a number of barriers because there are quite a lot. But you see, the first thing first, actually, our biggest barrier is our mindset. I know it's quite weird to mention something like that. Like I said, most of us don't really believe there's something that can be materialized out of this. You find even senior academicians who be asking you questions that they shouldn't ask, right? So our mindset already, for me, that's the number one barrier at the moment. The second one, this is resources. We are, for example, in LMICs, we are resource constrained. We would rather have a drug, and of course, we know to say the drug is there and it's doing something, but not really doing what it should do, right? Than spend a lot of money into technologies that probably will only cater for a few. So better we have millions of drugs that are not really working that well, than have little that will work just for a few number of people. So we have a challenge with resources, the funding gaps. You see, putting up the technologies is maybe quite expensive. I looked at the report. The report was saying technologies have become cheaper, but cheap is relative, right? Because what you may consider cheap in Nigeria, in Kenya probably it's not cheap. Maybe in Zambia it's not cheap. So that word for me is that term is relative. So we are having challenges around gathering resources. But the first thing is our mindset. You see, because if our mindset is positive about this, believe you me, we'll be able to get resources to invest into this. Yeah. So we have a challenge with resources. The third thing is infrastructure. Of course, there are quite a few African countries that have got good clinical setups. If you talk about those facilities, even just universities that have got good laboratory, rooms where students can do top-notch research. At the moment, um, if you just look at even most of the research that's being published in Africa, yeah, there is quite of researchers who are doing very well, but a majority of the researchers, you can look at the researches. We're just talking about one and the same thing. Most fields are not tapped into because we do not have uh, much of the infrastructure that can support that. Um, yeah, so I've spoken to our mindset, spoken to resources. I've also spoken to the infrastructure and also skills development. Like I said, there are very few, of course, individuals who've gone further, to specialize in this in the area of genomics. So you find that that also acts as a barrier because you have 5, 10 people, having this conversation, and billions of the individuals, are not listening, because only a few voices are having conversations. So also, skills, also lack of these skills has also appeared to be, a barrier. Apart from that, regulatory frameworks at the moment, it's quite challenging, to implement a research that has to do with, genomics information, right? You find that it's so stringent. uh, Sometimes researchers even just get to give up here in Africa. People begin to ask, there are a lot of ethical concerns. People begin to ask questions such as what will come out of those DNA cells, what will come out of this. So also those are part of the barriers, the regulatory issues, ethical concerns, etc. Yeah. So apart from resources at the level of governments, also just when you look at the buying power in Africa, most of our people cannot afford, to buy a PGX test. Looking at the current costs, most of our people, uh, are, uh, 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 are not capable of, buying a PGX test. You find that you have to buy a PGX test, for example, not in your country. Probably if you're in Zambia, you have to buy it from South Africa. So there are costs, to do the transportation and everything, even just the test itself. So I think all those are part of the barriers right now. But the biggest barrier, like I said, is our mindset.
Amazing, amazing. Yeah, I cannot agree with you more. Thank you so much, pharmacist Gibson. Thank you so much. To our listeners and watchers on YouTube and those joining us on YouTube, thank you so much. We're going to be moving straight now to the second phase of this engagement session, and it's going to be on, like we mentioned during the publicity session, navigating the tool Clean PGX. Clean PGX. So I know some of us may have heard during presentations before, especially during the first about GKB. It's the new name for GKB, right? You can look at it like that. It's the new name for GKB. So if you've known GKB before, Clean PGX is GKB. Okay, so we're going to be looking at GKB now. For those of us who knows it as that, we're going to be looking at GKB and seeing how to navigate the tool. How do you go through all of the different areas? How do you use the information that you have there on GKB, on Clean PGX, to be able to guide therapy, to be able to do whatever the information can allow you to? First of all, I'm going to be talking to us about what GKB is. What is GKB, or what is Clean PGX? GKB, or Clean PGX, which is called pharmacogenomics knowledge base, that's GKB, is a public curated scientific resource that collects basically and organizes, disseminates knowledge about human genetic variations that affect drug responses. So it basically curates scientific resources that collects, organizes, and disseminates knowledge about genetic variations that affect different drug responses. And What it basically does is that it integrates different data from peer-reviewed studies, different data from peer-reviewed studies to support pharmacogenomics in research, in education, and in clinical translation. Okay? Now, to those of us who are watching live on YouTube, I'd like to see in the chat, I'd like us to just drop in this. We've talked about in a couple of sessions, webinar series. So I'm curious to know what you think about pharmGKB or CleanPGX, what you know about it. What do you think are the core functions of pharmGKB? What do you think are the core functions of pharmGKB? Have you visited the website before? That's the second question. The first question, what do you think are the core functions of pharmGKB? How is it used in clinical practice? How is it used at all? Then the second question, have you visited the website before? Have you ever at any point in time used the website, whether you're a pharmacist, a clinician, a medical doctor, a nurse, or a pharmacy student, basically curious about information on pharmacogenomics? Have you ever visited that's our comments in the chat box? Let's just drop the comments in the chat box. Have you ever visited pharmGKB before? And what are the core functions of pharmGKB? Now, I would move to talking about the key content types that you find on pharmGKB. Okay, so before I don't know if our pharmacist is ready already. Pharmacist Gibson, are you ready?
Yes, Destiny, I am. Would you want me to share?
Okay, just a few moments. Just a few moments. So let me just talk about the content type on pharmGKB. So we have the clinical annotations on pharmGKB. We have the drug pathways for different drugs. That is explanation of the pharmacokinetics and pharmacodynamics pathways of information on pharmacogenes, whether you're talking about CYP2D6, CYP2C19, TPMP, or DPYD, and so on. Okay. We also have the variant annotations, which is some of the things that you're going to be seeing today as our pharmacist would be sharing his slides now and showing to us. Okay, so I'm going to stop sharing my slide now, Pharmacist Gibson, so you can put up your slide. Okay, yes. Pharmacist, you can put up your slide now.
Thank you so much, Disney. Let me just go straight to. I'll just go to the website.
Amazing. So I want to see our comments in the chat box. So I want to see the amazing comments we're having. For those of us or have or knows about the core functions of GKB, I want to see the webinar series we've been attending. I want to see if we've been taking at least a very good chunk of those information. Okay, I think your screen is yeah. Yeah, you can share the
I've just sent you a request.
Yes,
Able to see something?
I just accepted that now.
Oh, okay. Sorry.
Yeah, your screen is visible now. We can see your screen.
Oh, okay. So I just typed CleanPGX so that I can go to the website. the main website. I actually don't really consider it as just a website. This is a library. It's just something so massive. Yeah. So that's the I hope my internet will be good enough. Okay, are you able to see the many interface?
Yes, 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 yes. Very well, very well. We can see your screen and we can see the interface. Yes.
Oh, okay. Okay, so this is I think basically what you already had introduced, uh, Destiny. Um, of course, when you just go to the library itself, you get to find a question like what is clean PGX, what is pharmacogenomics. Then you find also the option down here for clean PGX blog. So here you get to check out publications, trends, new things that's happening, in the field of clinical pharmacogenomics. Yeah. Then okay, just give me a minute. Okay. So okay. So what you see down here, where my cursor is I think almost just what you see here. So this is a tab for pharmacogenomics drug optimization guidelines. Yeah, so you get to see guidelines on how you um, you can optimize drug therapy. Then there's these are guidelines on selection interface. Then the clinical pharmacogenomics implementation consortium. So you get information about these guys. So these guys are doing quite much work around developing, guidelines. Apart from these guys, there's also the DPWG, the Dutch Pharmacogenomics working group, and I think also many others, yeah, that are developing pharmacogenomics information. Then we are integrating it into Clean PGX. Then here you find now different, data types. Yeah, that may be useful to you. So first things first, Destiny, the Clean PGX website is very interesting when you look at it. When you look at this library, it's very interesting because it has got quite a lot of information. There is quite a lot. When you open these tabs, it just doesn't end at opening this tab. For example, the pharmacogenomics drug optimization guidance. You get to find that there's quite a lot that you can do under this tab. So the only way you can get to really appreciate uh, this library, the Clean PGX, is if you are doing something um, that requires you to make use of it. Then you get to realize that each day that goes by, you'll be getting some new information. You get to learn how to use new tabs, how to pick new information from here, yeah, right? So I'll just speak to the basic things, the many things that you get to find on the website. So, for example, uh, there's this tab for what is known as the farm dog, and where was I? Yeah, it's under what is known as the section for precision guidance. So there are these sections: precision guidance. There is curated PGX. So these are well organized PGX pharmacogenomics evidence. Then okay, you find also these components for knowledge, implementation, education. These are also sections. So these sections house different data, different information. So, like for example, the farm dog, the one for the pharmacogenomics, when you click on it, pharmacogenomics are drug optimization guidelines. So here there's a description that tells you exactly what these guidelines are developed for and what you get to use them for. So these two provide genotype-based drug prescribing guidance from CPIC. This is the Clinical Pharmacogenomics Implementation Consortium, the Dutch Pharmacogenomics Working Group, and also FDA, curated by clean PGX. What they mean by clean PGX is they've organized them well so that you can find them useful and also you can easily get access to them. So, for example, this filter is, good for individuals or clinicians, who are working in busy environments. You need to do, quick business. So, for example, you can use this tab to look at, for example, you've got genetic test results, right? You want to look at with this um, genetic test results, the PGX test result that we have in this patient. The disease is a cardiovascular disease. What drugs would be suitable for this type of patient? So you can either uh, use some, drugs that you already have to match the genetic test results, or the best you can use the genetic test result. You can click on there. So here you find different genes, right? You need to pair these areas. So you look at the PGX test results. What is on the PGX test results? Begin to match them. For example, we had, that allele. You match it with another. For example, the variant that is on the test results. Then, if you want, you can use the phenotype. Then you say, okay, let me view recommendations. So you get recommendations. You'll be told to say, oh, for that allele combination, most likely you find drugs that are used in musculoskeletal system diseases. Then you click here, you get to check what drugs can those be. So allopurinol, right? So that's just telling you to say for this PGX test result, right? The best drug you can use probably can be this allopurinol. Then there is more information about that drug. Recommendations here down here. You'll be told use 1.25 times the standard dose. There are even some computations down there how you need to titrate. So, like I said, this can be very useful for you if you're in a setting where you are doing this, right? It becomes very useful for you. But in a setting where you're not doing this, it may not be very useful because from time to time you can just forget how to use some of these tabs. There's also this tab here that helps you to compare PGX guidance from different sources. There are many sources that are producing guidelines, you see, for PGX, right? Like I said, you've got guidelines coming from, the Dutch Pharmacogenetics Working Group, pharmacogenomics, the Clinical Pharmacogenomics Implementation Consortium, those are coming from FDA. So you want to compare the guidances that are coming from different sources, right? Are they matching, right? Are they in tandem? So use this tab to compare such guidance. You also have the farm cut. So the farm cut translates the variant core formats into guidelines. I don't know why my internet seems to be poor. Yeah, the pharmacogenomics clinical annotation too. So here you find this container that's another to predict drug response. So here we're just using raw data to predict drug response. So processes VCF files from next generation sequencing or genotyping methods and identifies pharmacogenomics genotypes and infers these allotypes, typically called as star alleles. So this may be very useful for those who are doing bioinformatics research, like myself. Also genes, we'll tab for genes. So here you see actionable genes in PGX. So you get to realize that we've got quite a lot of genes. The human body has got millions of, of genes, a lot of genes, right? The human genome has got a lot of genes, but not all genes are actionable, in PGX. Some genes do not influence any pharmacogenomics outcomes. So here you get just to look at those genes of interest. For example, the CYP2D6, yeah, CYP, 2C19, such kind of genes. Then on the tab for drugs, you see drugs that are affected by pharmacogenomics. So you get to see drugs such as allopurinol, um, um, drugs such as the codeines, drugs used, in different diseases, the tamoxifen in breast cancer. You get to look at those drugs. So it's a comprehensive library. Then here you've got the tab for pair. So it explores gene-drug associations. So now, if you have the CYP2D6, how does it associate with this drug, right? Looks at those pairs. So it's a very vast library of information. A lot of things that you'll be looking for, you get to find them here. So now they created PGX evidence. Here you find that those that are well organized, you find guidelines. These are notated PGX-based clinical guidelines. So very easy, like I said, from what I was explaining from the farm job. If the results of this patient, for example, who is having TNBC, which is a triple negative breast cancer, the PGX test came out like this. What do the guidelines tell you about such a PGX test, right? You go into the database, you got the values from the test results, you enter them there, you get the guide. The guidelines tell you to say, okay, if the genotype looks like this, what that simply means that what is expressed in phenotype form is this. This person can be a poor metabolizer, this person can be an intermediate, or this person can be a rapid metabolizer with this type of phenotype. So the phenotype can be poor metabolizer or gives you that information. So in a case of where you are managing a cardiovascular disease or you are managing a TNBC, a triple negative breast cancer, the best drugs you can use are these and these. That's what you find in the guidelines. The drug labels here, let me just go into it. So mostly what regulatory agencies are contributing to PGX information. So there are some drug labels where you find, PGX information has already been, integrated, right? Speaking, for example, to things like warnings to look out for, contraindications, such things. So you can come here, read about those drug labels. Then just some literature about early drug associations from published literature. Some research that has been done and has been published out there. So this site gathers it, puts it together, then brings it here. So if you're doing some research and you have to do your literature review, it's quite interesting and easy. You come here because you find that most literature here is well organized for you as a researcher. Unlike just going to, for example, you go to Google Scholar, etc. You find quite a lot of things. But if your research is specific to pharmacogenomics, the best place to look out for literature, you come here. Then also you find the tab on pathways, the evidence-based drug pathways diagram. So this mostly speaks to pharmacokinetics. You are talking about drug transporters. You're talking about metabolites that are involved, that influence some of these drugs. For example, when you are talking about the process of pharmacokinetics, yeah. Then you also find the tab for pediatrics. So here you find, PGX information just related to pediatrics. So this information has been isolated from the pool of many to be specific just for pediatrics, so that it's not mixed, it's not confused. This is a special population, right? Because the drug dosing, even the choices of drugs themselves are quite different from what we give in adults. I just hope we can have a section specifically for geriatrics here, just like we have done for pediatrics. Yeah, so you get such information from here. Then more information about CPIC, for example, what you're going to find. So this takes you to, basically the CPIC website. An overview about what CPIC is, the guidelines, the gene tables, almost the same things that we've just looked at here. Yeah. Then there's a section on knowledge where you can learn about cancer pharmacogenetics, uh, PGX drugs used and addiction, the allele frequencies. You want to know how frequent are these variations? You can come here. Information about implementation. So here, these are, for example, this is an association for molecular pathologists. They are also doing some work, to support implementation of PGX. FDA also is doing quite a lot of work, like I said, where they are more focused on drug labels. So you can learn on how these different organizations are contributing uh, towards implementation of PGX. Then you find educational resources. There may be different resources, research, uh, etc. Publications, how you can publish if you have um, some work to publish. So basically, this is what this website is all about. I mean, I don't call it a website; it's a library because there's just quite a lot. Here, for example, should you open this tab, you get to realize that you're not just be looking at one thing. Sorry, still loading. You get to realize that there's quite a lot you can just get to look at just that tab, right? So you find some guidelines. There's quite a lot. So the best way to learn all about Clean PGX is for you to find time and then begin to learn uh, deeper now into what each and every tab speaks to. But most importantly, is if you are actively participating in genomics, then it becomes something that you can easily learn and something that's going to be very interesting to you. But if you're not doing anything related to genomics, it becomes a challenge. So you can begin to do some literature review, scoping reviews, just to, publishing some articles around what is just, on CleanPGX. Then you get to learn more about the website because you have something that will be bringing you here to interact with the website. Yeah. Thank you.
Amazing, amazing, amazing. Thank you so much, Pharmacist Gibson. Thank you so much. I think this has been a very, very amazing session. And I know that our viewers on YouTube would have gotten a lot of insights into going around from GKB, the kind of information you can find there on Farm DOG, on farm cards, on GXI, on genes, on drugs, and the drug gene pair. It's been amazing. Thank you so much, Pharmacist Gibson. I'm certainly, yes, you spoke about pediatrics, right? You spoke about pediatrics, and it's a whole lot of ball game because dealing with children, dealing with medications when it comes to children is something that is really, really, really interesting and requires a lot of attention. So yeah, certainly we could schedule another time for doing that if that would be fine with you. I really don't mind. I'm very open to that as well.
Okay. Thank you so much. Yes, we can. Yeah.
Thank you so much. Thank you so much. Thank you so much. So we're going to move right now to taking questions from the live chats. I don't know if any one of us have questions in the live chats. Please, let's do well to drop them so we can take them right now. Regarding Clean PGX, regarding FarmGKB, which is Clean PGX, let's see your questions. I'm looking to the chat now. I haven't seen any questions yet. No one has dropped any question yet, but we'll take that as soon as they drop. Right now, okay, this is not a question. Right now, we just move straight to the ambassadorship program. We just move straight to talking about the ambassadorship program, and then we would be going to the last part of today's session, right? The last part of today's session. So let me just try sharing my screen. Yeah. Okay, so some of us may have asked, just like I've gotten a lot of questions from the WhatsApp waiting room, about what the ambassadorship program is and what it represents. How do I get into it? How can I be an ambassador for Pharmagenosphere? And I'm going to be answering those questions now. So, first of all, what is the ambassadorship program? What is the Pharmagenosphere ambassadorship program about? The ambassadorship program is basically about us um, moving beyond what we are currently doing. Yes, we are able to organize webinars here in Nigeria, and we're able to get at least participation from across the world. But we believe that if we have persons in different regions of the world, we would be able to be at the table where the decisions are made, at the grassroots where the decisions are made. We'll be able to meet policymakers, we'll be able to create advocacy networks, we'll be able to create efforts to be able to talk to persons in different areas, in different sector of healthcare, who can start doing something about implementation of pharmacogenomics, who can start maybe even discussing about pharmacogenomics in their meetings, in the healthcare space meetings, the pharmacy meetings that they have in the hospitals, the medical doctors meetings they have in the hospitals. So the ambassadorship program is basically to expand the scope of our advocacy at Pharmagenosphere. So we want to take the message to the different parts of the world. We want you who have been participating in our webinar series, in our events, whether online or offline, to now take the message that you've heard to other persons, because we believe that implementation of pharmacogenomics and precision medicine as a whole has a lot to do with creating awareness and creating this discussion around pharmacogenomics. And we cannot just continue to discuss about pharmacogenomics amongst ourselves when we come for webinars like this. We have to take the message to the woman in the street. We have to take the message to the market man, the market woman who is selling in the market. We have to take the message to the man who is the mechanic in the street, and make them see how this is relevant to them, right? Make them get basic knowledge about why getting genetic tests can save their lives. Make them see reasons why it could be beneficial to them to ask the doctor in the hospital, for example, about the possibility of getting a pharmacogenomics test. Okay, so this is basically the reason why we are having this ambassadorship program. Okay, so be able to bring the advocacy to the grassroots level, not just to the media space, not just to social media or to, because at the end of the day, when we do these webinars, we upload them to YouTube, and then some persons are able to view it. But then, how about the people who are not able to see these messages? How about the people who are not able to see these news? So it is a strong reason why we are opening the ambassadorship program. I'm still looking into the WhatsApp group chat to see for messages about navigating Clean PGX, but I'll move on with the ambassadorship program. Now, how do you become part of the ambassadorship program? That's the next question that a lot of persons have asked. And it is very simple. We've sent out an application form. We've sent out an application form some months ago, and a lot of persons applied. We had screening, but during the last webinar session we had with Dr. Zaina, a lot of other persons reached out about being part of the ambassadorship program. So what we did was to open the form again for more persons to apply. So if you can hear me now, those of us watching on YouTube, you can apply to join the program by applying on the form, by filling the form that we've shared out. You can check our LinkedIn page, Pharmagenosphere. You can type Pharmagenosphere on our LinkedIn page, on your LinkedIn, and you'll see our LinkedIn page. And then you see the form there. Fill the form, and we would get back to you. Certainly, for everyone that fills the form, we certainly would get back to you, regardless of whether you'll be selected or not. So try as much as possible to take your time to fill the form. We want to get your honest opinion, because we want persons who would be able to be part of changing the narrative as far as precision medicine is concerned in Africa and in other low and middle income countries of the world. So the next question that I have been getting is about what the activities would be. What are you going to be doing as an ambassador, and what roles would you be playing as an ambassador? It is very simple. It is very simple. And it is very simple because it borders around the concept of all of the things I said earlier, that we want to push the message to more persons. We want the message to get to the medical doctors, to the nurses. I know that a lot of persons join our webinars, and sometimes we see some medical doctors, we see some nurses, but we have not gotten so much participation from these persons. And it therefore means that a very good number of them do not know about this. And in many hospitals you go to in the world today, the medical doctors are usually the head of the hospitals, and they're the ones making the policies, in charge of making the policies. Okay, Pharmacist Gibson, can you hear me? That was,
Yes, yes, I can hear you now. I don't know if it was my network or it was yours.
I think it was mine. It was mine. It was mine. It just went off here. So sorry about that. So we're basically pushing the message, right, to the policymakers, to the government officials. I don't think my screen is being shared currently. So let me just do that. Okay. Okay. So we want to push the message to the different ends of the earth. So how do you push the message? You may ask me. You can organize webinar series just like we're doing now. You're very free to do that. You can organize outreach sessions, which is basically to communities, to universities, and different parts of your country, to basically talk about the message of pharmacogenomics and precision medicine. A lot of these things that I'm talking about now would be detailed during the onboarding session that we're going to have. So for those persons that would be selected at the end, we'll be having an onboarding session where we will take you through all of the things that are required to know, all of the things that you could do as an ambassador, and we'll brainstorm areas that you certainly can explore as an ambassador to contribute to the field of precision medicine and pharmacogenomics. Okay, and then the last thing that a lot of persons have asked is, what do I stand to gain? Of course, if you're participating in something like this, you should gain a lot of things, right? So we have a research arm at Pharmagenosphere, and we've been conducting some research here in the University of Benin. And what we intend to do with that, for persons that applied, there was the track about the research ambassadorship. So for those persons that apply for that research ambassadorship, we're going to be having trainings, right, on research, how to conduct research in the field of precision medicine, how to get collaborators, and all of those sort of things. How to get research topics, and how to look for those areas that you can easily delve into with your low resources, right? We are going to be delving into all of this. We're going to be having workshop and sessions that will be delving into all of this. And at the end of the day, we're going to try to work with you to ensure that you are able to put out your studies, whatever research you've done, you're able to publish it, okay? We're going to work with you every step of the way. And we have very, very highly recognized and globally recognized experts who will be able to support us in this regard. So that's not going to be a problem. And so the next thing that I think that you would benefit from this is the fact that you'll be contributing to something big. Yes, you'll be contributing to something big. And just like I told some persons after the last session we had, pharmacogenomics and precision medicine, and even like pharmacist Gibson had mentioned earlier, is literally here to stay. And I don't like to call it or see it as the future of medicine. I like to see it as the area that medicine is evolving into, because there will come that time where you will not have to be able to prescribe medications, or you will not be able to treat a patient without precision medicine, without dealing straight into pharmacogenomics, which is at the heart of precision medicine, right? So putting your steps, putting yourself into this space at this time is very strategic, not just for your career, but for your future ambitions as well. So putting yourself into the space is very strategic, and having an organization to be able to work with is even very strategic, even more strategic. So that is another thing I think you're going to gain from this, participating as an ambassador. Very surely of the cohort, which is going to be for 1 year, at the end of the cohort, we're going to be issuing certificates to all ambassadors. Okay, we're going to be issuing certificates to all ambassadors. And before the issuance of the certificates, we're going to be having sessions, workshop sessions that are specifically tailored to the ambassadors. So we're going to be building capacity in pharmacogenomics education. So if you're an ambassador, you have to be able to communicate pharmacogenomics to other persons. So we're going to be building capacity in pharmacogenomics. We're going to be having specialized sessions for just the ambassadors, where you would learn in depth about pharmacogenomics, not just the webinar series we have where, okay, we just talk about some basic things, right? We're going to be going in depth into how you can delve straight into pharmacogenomics, the various aspects of pharmacogenomics, and how you can be sure to make a career out of it. And very importantly, we're going to be doing something which is something that we've never done before. We're going to be having sessions on startups and innovations in precision medicine and pharmacogenomics. So we have an introductory session during this nine session series we're having. We're going to be having a more robust and tailored such sessions in the ambassadorship program, where we'll be able to build capacity in innovations and startups in the field of precision medicine and pharmacogenomics. And ladies and gentlemen, I can tell you that this is probably the most important part of the ambassadorship program that you're going to be getting for free by just being an ambassador of Pharmagenosphere. And all we are asking in return is that you help us take this message passionately to the different ends of the earth, to the different parts of the world, to your communities, to your school, to your lecturers, to students in your school who are not even pharmacy students or medical students or nursing students, who are not even in the healthcare space, to make them see the reason and the need to even do genetic testing, to even think about getting a pharmacogenomics test done someday. So I believe I'm going to drop it here now. I'm going to drop it here now. Our time is fast spent already. We're almost clocking 2 hours already here. Pharmacist Gibson, I'm really sorry about the fact that the session has been really extended. Thank you so much for being with us today. So I am looking at the chat box now and I see questions about the Clean PGX and from GKB navigation. So I think it would be a very perfect time to round off the session for today. Any final words from you, Pharmacist Gibson, about anything at all to our very teeming viewers on YouTube?
Thank you so much, Destiny. I greatly appreciate the invitation to come and be part of this conversation, and I would be very grateful to be part of even the future conversations. Let us keep this fire burning. Let us keep the conversations going on. I'm very confident that there is much to come out of these conversations, and the future of African medicine is very bright. Yeah. To our colleagues on YouTube, uh, those who may be more senior, uh, those who may be um, maybe as us the youths, together we've got one thing that we can contribute to, and that thing is the future of genomics in Africa, and this is what the conversation was was all about. Yeah, let us go out there like Jasmine has mentioned. Let us share the message. Let us preach this message, and let us be part of the change makers. Like I earlier said, Africa should not always be the last ones to wake up. I think for once we should be part of the frontliners, in driving change. We should be part of the frontliners, in bringing something new, to the globe. Yeah. So thank you so much, everyone. And whenever there's a conversation around genomics, pharmacogenomics, please don't hesitate, Destiny, to engage me. Have a blessed evening.
Okay, thank you so much, Pharmacist Gibson. Thank you so much, Pharmacist Gibson. We are very grateful for you choosing to be here today. We're very grateful. I want to say a very big thank you for being part of today's session. For those of us who are watching on on YouTube, I see we've been asking about the attendance sheets on the in the chat. You can sign that now. I just sent the link to the YouTube chat. You can send that now. Okay, so what do we have to say to our speaker for today, our guest for today? I'd like to see many thanks in the chat box. I just dropped the attendance sheet now, so you can go ahead and sign the attendance. And Pharmacist Gibson, once again, thank you so much. We are very grateful for this privilege, this opportunity that you've shared with us today. We really appreciate it. Thank you so much. Thank you so much.
Thank you so much. Have a blessed night. I appreciate a lot.
All right. Thank you so much. Good night. All right, guys, that's our program for today, the very first of the edition of the Pharmagenosphere Community Engagement Session. And this session today has been really amazing, and I believe it's been amazing to you as well. So I want to see our amazing comments in the chat box. I specifically want to see the areas you think we should improve on this session. If there are things that you think we should do better, please do well to share with us in the chat box. Let's grow together. Let's grow the field of pharmacogenomics, the field of precision medicine together. And one thing that I'm going to promise us is that we'll continue to bring us these sessions like this and we'll continue to make it even better. We'll continue to make it even better. Okay, so we're going to be having even more practical sessions like this, right? Like the navigation of the Clean PGX tool that we looked at earlier. We're going to have even more sessions like that where we can navigate this tool, learn how to navigate these tools, and be able to learn how to implement basic pharmacogenomics skills, right? Basic pharmacogenomics implementation guidelines that we can easily find on these tools like PharmGKB, right? And whether you're working as a community pharmacist, or you're working as a hospital pharmacist, whether you're a medical doctor, you're a nurse, we can see how to implement these basic things. Okay, so we're going to promise to bring even more of that. And one thing that I'm going to plead with us with is that we continue to support us. And how do you support us? You support us by dropping your comments in the chat box, by dropping areas you think we should focus more on. Okay, we are only here in Nigeria. We cannot see how the situation is in Ghana. We cannot see how the situation is in Zambia. We cannot see how it is in Pakistan. We do not know how it is in India. But with your information, with you dropping your comments in the chat box, with you reaching out to us about areas that we should delve into, we can be certainly able to tailor the sessions to your specific needs. So thank you so much, everyone. It's going to be our session for today, and we would call it a wrap now. Thank you, thank you, thank you.